This is going to be my nursing physical assessment of the lungs and the thorax. So you immediately walk in. Hi, how are you? My name is Adriana. I'm going to be your nurse for today. Okay. Introduce myself to the patient. I'm going to wash my hands for 20 seconds with soap and water. Come back. Make sure this is the right patient. Have his name. Check his wristband if he has one. Okay. Go in. So I'm going to ask you some questions. So do you have any pain? Any anxiety?
No.
Okay. These questions indicate if there's any changes. If he has any anxiety or any pain, that might change his respiration rate, might make him breathe more. Okay. And have you had any recent changes in your respiration? Any difficulty breathing in the last couple of days?
No.
No? Okay. Good. So now we're going to start off with inspection. So I'm going to be touching the front of your chest and the back of your chest, okay? Let me know if you feel uncomfortable and I will stop. So with inspection, I'm checking for his color. Everything seems nice, pink, warm to touch. Note if there was any sort of blueness, any coldness that can indicate inadequate oxygenation. Okay, he has perfect chest symmetry. When he's breathing, both of his chest walls are going up. And now we'll take his respiration rate. So for 1 full minute. Okay, confidence respiration rates, it was at 18. Normal respiration rate is 12 to 20. Anything more can indicate respiratory problems such as asthma. Anything less could indicate another potential issue that he's not receiving enough air. Okay, after that inspection, we're going to move on to palpation. So I'm going to palpate and feel the front and back of your chest, okay? So just gently touch and palpate the front and the back of the chest. So this palpation is to indicate if he has any tenderness, any sort of pain that he probably isn't aware of, or to check for any growth or nodules, something indicative, like perhaps a cancer or something like that. Okay. Now after that palpation, I see there's no growth, there's no pain. So now I'm going to check for a tactile fremitus. So I'm going to put my hand right here, and you're going to say 99 for me.
99.
Okay.
99.
I'm going to check from the back.
99.
One more time.
99.
So tactile fremitus is present. That is a vibration that you'll feel while he says the word 99. And it's good that it's present. If it was absent, that could probably indicate some sort of inflammation in the lungs and the bronchioles. Okay, that's perfect. Great. So now we're going to move on to percussion. So I'm going to gently, sitting straight. Thank you. Okay. So, one more thing. I'm going to check for chest expansion for palpate. So I'm going to put my thumbs right here at the bottom of the sternum. Bring them in. And I'll do the same for the back. Breathe in, please. Okay. So as equal chest rise, equal chest symmetry, because as I put my thumbs together, when he breathes, my thumbs move away, and then they move closer when he exhales, which is a good sign. So moving back to percussion, I'm going to percuss right here. Okay. I'm just going to check right here. Okay, sorry. Check the other side. Then I'll do the same for the back. When you're percussing in the back, make sure to avoid the scapula area. That's to find the ribs, in between the ribs. Okay, so the sound you want to hear when you're percussing is resonance. If you hear anything dull, that can indicate you're just percussing over a bone. So you want to hear some sort of resonance because the lungs are filled with air, and this is something that you would hear. So next up on my assessment is auscultation. So I'm going to put on my stethoscope and I'm going to hear your lungs in your front and your back, okay? So just breathe in for me. Now I'm going to also take from the back. Mind raising your hand up for me? Breathe in. And over here. Okay, great. So I hear clear lung sounds, no adventitious sounds, no bronchi, no wheezing, or anything like that. So when I auscultate up here on this area of his chest, I hear bronchial sounds, which is a very loud pitch, loud noise, which is normal. When I go a little bit down to the second or third rib cage, up to here, I would hear bronchovesicular sounds, which is also considered a medium pitch, medium sound as the patient breathes in and out, and that is also very normal. Moving down to over here, you would hear vesicular sounds to the perhaps at the bottom lobes of the lungs, and that's just low pitch, low sounding lung sounds. So that was my physical assessment of the thorax and the lungs. Thank you so much.